In this section, we'll be looking at partial agonists and inverse agonists. So we'll be reviewing the function of both partial agonists and inverse agonists, and these perform a function that is somewhere between the two extremes of agonist and antagonist. So first we're going to talk about the concept of a partial agonist. Now a partial agonist is a molecule that is able to bind to the binding site within a receptor. However, when it binds to the binding site, it doesn't fully activate the receptor. So it can result in a conformational change or an induced fit in the receptor that is not ideal for activation. Now what this means is that the receptor is only partially activated instead of fully activated. And this results in a decrease in the subsequent effects in whatever it is that the receptor activates. Now just to give you an example, here is the partial opening of an ion channel. So here we have a partial agonist. It's a molecule that is larger than the natural messenger, but it's smaller than a complete antagonist. Now it binds into the binding site and it causes a slight conformational change in the receptor. This results in a partial opening of the ion channel, so it means that it can let in and out a small amount of ions. However, the transport of the ions won't be as efficient as if the ion channel were fully open. Now, partial agonists can even bind in lots of different ways to the same receptor, and they can do this because we can utilize different binding regions within the binding site. And this means that the partial agonist could bind in lots of different ways. So if we're thinking of a population of receptors, maybe we have tens or hundreds or thousands within a cell, it means that some of these would be activated by the partial agonist, and in some of those binding modes we could even have the partial agonist acting as an antagonist. So it means that some of those receptors would be active partially and some of them wouldn't. Now equilibrium between these two binding modes will determine the level of drug activity. So if we have a drug that prefers to bind in a binding mode that partially activates the receptor, then we'll have more activity over that population of receptors than if we have a drug that prefers to bind in a binding mode that is antagonistic to the receptor. And it's the equilibrium between these two modes of binding that will determine the overall activity at that receptor type. Now next we're going to have a look at inverse agonists. Now some receptors have an inherent activity even in the absence of a chemical messenger. So even without the presence of a chemical messenger, they can be partially activated. Now this is thought to be because there is an equilibrium between an active and an inactive conformation, and receptors can sometimes switch between the two. Now this suggests that receptors are not fixed in an inactive form. They can still have a small amount of activity without that messenger molecule. Now an inverse agonist has the same effect as an antagonist, so it stops receptor activation, but it also prevents the activity associated with the natural equilibrium. So it means that this baseline activation that you get with some receptors, an inverse agonist can stop even that. So it can guarantee that a receptor is completely turned off. So just to explain this in a little more detail, we're going to have a look at the effect of equilibrium on the activity of receptors. Now here we have a receptor in its resting state. Now in this resting state we will have mostly inactive conformations, but we'll have a very small number of receptors that are in an active conformation. And this is because when a receptor isn't activated, it's still able to move, it's still able to be flexible, and so it can flex between these two forms. So we have a very small amount of active conformation and a large amount of inactive conformation. Now if we add an agonist to this system, we will have a small number of receptors that don't have the agonist bound to them, but most of the receptors will have the agonist bound in the binding site. So this pushes the equilibrium far over towards the active conformation. So whilst we'll still have a very small number which don't contain the bound agonist and are inactive, most of them will be pushed towards this active conformation. Now the opposite happens if we add an antagonist. So if we add an antagonist, most of our receptors will be in the inactive conformation, but we'll still have a very small number that are able to flex to the active conformation. Now remember, the antagonist stops the natural messenger molecule from binding, but it doesn't stop the natural flex of the receptor. So the receptor is still able to be flexible, and a very small population will be active. This is the same as in the absence of any agonist or antagonist. But it means that we block the interaction of the natural messenger molecule. Now, if we add an inverse agonist, we completely eliminate the population of active receptors. So we push this equilibrium all the way over to the left, and all of our receptors will be in an inactive conformation. Now, if we add a partial agonist to our population of receptors, this means that we will have some, or a majority, that are inactive, but we'll have some which are partially activated as well. And so the addition of a partial agonist puts the level of activation at less than that we would get if we added a full agonist, but we have more in the active conformation than in the absence of that partial agonist. And so receptor activation is almost always a function of equilibrium. We will have, in a natural population, in the absence of agonists, antagonists, partial agonists, and inverse agonists, we will have a small population of active receptors, but the majority will be inactive. If we add a partial agonist, we increase the population of active receptors, and if we add a full agonist, we drastically increase the population of active receptors. In contrast, if we take our natural resting state and we add an antagonist, we will drastically reduce the population of active receptors, but we won't completely eliminate receptor activation. If we add an inverse agonist, we will completely eliminate receptor activation from the system. And so the inverse agonist gives us the lowest level of receptor activation, or the highest amount of receptor inactivation. Now, in the next and final section, we will have a look at some examples of drug molecules interacting with other types of protein targets. So we'll be looking at an example of drugs interacting with transport proteins, structural proteins, and molecules that inhibit protein-protein interactions. In this section,